Hello. Hello, good morning. Hello. Ah, lovely to hear you, and a warm welcome to the 2025 edition of the Union World Conference on Lung Health here in the beautiful city of Copenhagen. Woo! Well, I'm Nadine de Reider, and it's a great pleasure and privilege to be hosting this year's opening session for the world's leading lung health event. So whether you're here today with us in the auditorium, and it's looking pretty busy, or watching elsewhere in the venue, hello to you, or joining us online remotely from all around the world, wherever you are, thank you so much for being part of the global fight for lung health. And if you are here with us in Copenhagen to help you get the most out of your time here, if you haven't done so already, please remember to download the conference app for the most updated programme and event information. And to make that task easier for you, conveniently on the back of your badges, you may have noticed that there is a QR code, and you just need to scan that QR code to download the conference app. And also you'll see the Wi-Fi details alongside the QR code. So again, if you need a boost to your signal, there is the Wi-Fi details. And I love the imaginative password. It's Copenhagen. So I think we've all got that. So yes, the conference app is a really good source of information. And while you're getting your devices out, if I can make sure they're all on silent throughout this opening session, as well as the rest of the conference sessions throughout the week, that'd be very much appreciated. Now, alongside the events team, I've been crunching this year's conference numbers, and so far, we have over 3,000 delegates and attendees drawn from over 130 countries, so it is truly global. And if those figures, there's a little bit of a round of applause. Yep. Wait for this, though. And if those figures weren't impressive enough for you, well, how about these? Because we have over 200 different session programs throughout the week, and we have 1,440 speakers taking part. Yes, 1,440 speakers taking part. So let's give them a round of applause in advance of the week. And that takes some organisation, doesn't it, to put on such an ambitious, thought-provoking and diverse programme. So this event really is a golden opportunity to connect, collaborate and create impact in this space, and to coordinate those efforts in the fight against lungs diseases. And it's personal, isn't it, for so many of us in the room today, for a variety of different reasons. I know firsthand the impact that you as a community coming together have. Having had chronic asthma myself and numerous bouts of pneumonia when I was growing up. So hearing firsthand the lived experiences from so many of you at the Union Conference really is a compelling reason why this week is so important. And this year's conference, I think, is more important than ever before because it brings together global experts, researchers, advocates, and community voices across TB, lung disease, pollution, global development, and advocacy, all in one place to share the latest scientific breakthroughs, policy debates, and community-driven solutions, shaping the future of lung health against the backdrop of shrinking global health funding and widening inequalities. And those themes are reflected in the opening session because we'll be hearing from both the Executive Director and President of the Union, as well as also hearing from Dr. Hans Kluge, Europe's Regional Director of the World Health Organization. So welcome to you. We'll also be announcing this year's Union Medal winner, and that's always a real special moment, isn't it, of reflection and celebration to honour an outstanding contribution to lung health. And drum roll, please. Thank you. We also have John Green in the building. Yes, a best-selling author who'll be delivering this year's keynote. And John, yes. Thank you, John. There's a lot of love for you in the room, John. John has been a vocal advocate for increased access to treatment for TB and wider awareness of the healthcare inequities that allow this curable, preventable, infectious disease to also be the deadliest, killing over 1 million people every year. So we really do appreciate you being here, John. And we'll be actually doing the opening session justice right at the very end with a spotlight on community voices. And that's bringing together the affected communities and civil society representatives whose presence is critical to ensure that policies and actions address the real needs of people on the ground. So thank you to them. I'd also like to thank all the volunteers who've kindly given up their time, energy and commitment. And the volunteers are a really important part of the delivery team. So please be nice to them because they've given up a lot of their time. Yeah. And they're an important part of making this conference a huge success. So from the bottom of our hearts, a big thank you. Well, let's get the programme officially underway. And to officially welcome everyone here to the conference on behalf of the union, please give a very warm welcome to their Executive Director, Dr. Cassandra Kelly-Cirino.
Good morning, everyone. Thank you so much for joining us today. To our distinguished guests, First Lady of Nigeria, the Vice Minister of Health, Republic of Indonesia, all of the conference delegates, I am delighted to welcome you here to the World Conference on Lung Health in Copenhagen. I'm thrilled that so many of you were able to actually join us in person, and for everyone that's joining online, your presence is missed, but we know that you're actually engaged on the content and you're looking forward to being able to interact as much as possible with all of the delegates here today. This is guaranteed to be a thought-provoking and inspiring 4 days. I appreciate how difficult it was for some of you to make it here, and that is going to be reflected, I think, in the energy that you bring to the week. The Union Conference is the platform that brings every part of lung health together across the world, and it reaffirms our commitment to the fight to end TB and lung diseases globally. In the face of devastating funding cuts in the past year and geopolitical turmoils, we must squeeze every drop of potential from this week. It is our responsibility as those that are privileged enough to be here to make sure that we make the most of this opportunity. Having explored the program, which is very dense, I know it will be a catalyst for real change and for dialogue and discussion. I hope it will expand your knowledge, stimulate debate, and allow us to collectively try to address the real problems facing each of us in all of the countries that are faced with TB and lung disease. For that, I would like to just take a moment to say thank you and express my gratitude to everybody that's been involved in pulling this conference together. First, a special thank you to the advocates and the affected communities for courageously sharing your voice with us during the week and today. You are heard and you are valued, and we must keep all of your words front and center every day as we go about our work. A massive thank you to the conference's scientific committee, the Union Community Advisory Panel, the TB Science Scientific Committee, the conference subcommittee of the board, and the conference team for all of your tireless dedication to putting this incredible event together. I can't imagine how difficult it was to have to review over 3,000 incredibly high-quality abstracts to put our program together this week. I know that you did everything you could to accept all of them, but unfortunately, we weren't able to have a 100% acceptance rate. But there is a broad range of topics and new topics this year that are going to stimulate dialogue and discussion. Thank you for all of the work that you did to put this program together. A thanks to our exhibitors, our sponsors, and our donors. You have made this week possible, and we appreciate all of you taking the time to be here. A big thank you to all of our volunteers. Without you, we could not put this together. You're an incredible piece of the fabric of the week, and we very much appreciate you taking the time to volunteer for us and help us make this a success. Like all of you, the union has been severely hit by the loss of aid over the past 12 months. It has been an unbelievable, difficult storm to weather. When we were standing here in Bali having this discussion last year, none of us foresaw what was coming. Our commitment to the vision of a healthier world free of TB and lung disease has not wavered. This incredible resilience of all of our communities, partners, and my team and colleagues at the Union has never shifted. It is that spirit that inspires, I think, all of us to be here today. We are not in calm waters yet, but we are taking every step possible to be able to adapt to the challenging landscape that's facing us all. We are committed to creating a sustainable union that is able to see us through to the very end where we actually achieve an end to TB and lung disease. One such step has been the appointment of our new Chief Scientific Officer, Dr. Cassandra. This is an important piece to the Union's strategic advancement, and in just 2 short months, he's already made such a massive impact across our organization. All I can say is thank you for joining the Union. We're shining a light on the underrepresented lung health topics and conditions now more than ever. Through the launch of new Chronic Respiratory Diseases Journal, if you haven't seen it, please check it out, and making our presence felt during the UN General Assembly and the high-level meeting on non-communicable diseases a couple of months ago in New York, the Union is not just representing TB, but also we're championing lung health as an expert and a community partner. Our connection with the broader lung health community has never been stronger. Dr. Guy Marks, our president, is also now the president of the Forum for International Respiratory Societies. How Guy keeps up with this, I have no idea. A special thank you to him for having the amount of energy that he does. We're joining forces with allies like the NCD Alliance and the Union for International Cancer Control now more than ever. And we brought the Tobacco Control Conference back to the community for the first time in 7 years earlier this year. What a success that was, and we look forward to bringing it back again in a couple of years. It is an honor and a privilege for the Union to unite us all this week and play our role as the pathfinder of lung health community. While it is our responsibility to create the environment for progress, it is down to us, all of us, to take responsibility and make the most of the time that we have together this week. I hope that you'll all spend some time sharpening your skills, connecting with new and old partners, and most importantly, making sure that we apply everything that we learn to serve the people and the communities as best as we can. The Union is always a little bit like coming home for me and for others. I just had this discussion earlier. It's really like finding your space again over the years. So please take a moment, reflect on how privileged we are to be able to come together in this kind of a space, learn from each other, and please celebrate all of your successes. I hope you have a successful, rewarding, enjoyable time at the conference. Together, let's end TB and lung disease. Thank you.
Thanks so much to Cassandra. Very well said there. And your next speaker is Dr. Hans Kluge, who's served as the WHO Regional Director for Europe since 2020, although has been involved with the WHO for many years. He's a Belgian physician and global health leader, and he brings over 30 years of experience in medicine and public health. And as the current position as Regional Director, Hans has guided the region through COVID-19, conflicts and climate crises, while advancing digital health, mental health, and cross-sectorial collaboration to strengthen resilience and well-being. And I believe he's also based in Copenhagen, so he's probably had one of the easiest journeys to get here this morning. So please give a very warm welcome to Dr. Hans Kluge.
First Lady, Vice Minister, my sisters and brothers, welcome to beautiful Copenhagen. This week is a gathering of what I call a global family, united by a shared vision to end the suffering caused by tuberculosis and lung diseases. TB remains the world's deadliest infectious disease. We face drug resistance, TB-HIV co-infection, inequities in access to care, and maybe most frustrating, dire funding perspectives which really threaten to halt the tremendous progress, just as science and innovation are giving us the new tools to finally eliminate diseases. But my brothers and sisters, I also got to learn something. We, TB and lung disease fighters, are a very special breed. You have something I haven't seen anywhere else. It's an iron determination to leave no one behind. I myself, I have lived that determination when I was fighting XDR-TB in the prisons in Siberia, during the wars in Liberia and Somalia, during the rescue and search effort for surviving tuberculosis patients after the deadly cyclone Nargis in 2008 in Myanmar with heroic community midwives. All of you have traveled from every corner in the world with your own specific expertise, your lived experience of the communities. I'm seeing already world experts. I had the privilege already to meet Professor Peter Piot, my teacher, Professor Heidi Larsen, director of the Vaccine Confidence Project, and many more. And I always say, it's that diversity in unity which really is our strength. I myself, recently, I got unanimously re-elected by the 53 European member states as the regional director for my second mandate, and I have made the elimination of TB a top priority in my second mandate. But today, I'm not standing here as European. I'm standing here as a global citizen. This week, we are all global sisters and brothers, refusing that financial shortfalls dictate the lives of millions of people. We have to be bold in our advocacy, relentless in our pursuit of health equity, and creative in mobilizing resources. It's such an honor today to share the stage with John Green. Thank you so much. Your book, Everything is Tuberculosis, traces TB leading and shaping civilization, and also why it still persists, not merely due to the mycobacterium, but due to social injustice. I tremendously enjoyed the book. I think all of us did, and the story starts in Sierra Leone in 2019 when John met Henry Reider, a young TB patient, through the international NGO Partners in Health. And it was, I understand, Henry's courage who inspired John's fight for fairness. Actually, it's John's storytelling and Henry's experience who remind us of the values we need to uphold in this turbulent world. Justice, equity, and solidarity. The very values that we need to reshape the fight against tuberculosis. My brothers and sisters, again, welcome to Copenhagen.
Thank you to Hans, and what a warm welcome that was. Thank you so much. Well, next up, we're very grateful to have John Green here with us today as the keynote speaker for the opening session. John is an award-winning, best-selling author of books which include Looking for Alaska, The Fault in Our Stars, and Turtles All the Way Down. John is a well-known global health advocate and serves on the board of trustees for the global health non-profit organisation Partners in Health. And in partnership with the nerd fighter community and Partners in Health, John, along with his brother Hank Green, who otherwise known, I think, as the Vlog Brothers, who by their own admission are raising nerdy to the power of awesome, love that, have helped raise over $30 million, US dollars, and I'm sure that amount is increasing all the time, to tackle maternal mortality in Sierra Leone. And notably, a couple of years ago, John spoke at the United Nations calling for the eradication of TB cases in the next decade. As Hans mentioned, John also wrote Everything is Tuberculosis, which is a deeply human story illuminating the fight against the world's deadliest infectious disease, as you mention, Hans, through the eyes of Henry, a TB patient. And Henry's story is woven throughout the book with scientific and social histories of how TB has shaped our world and how our choices will shape the future of the disease. And today, John is here to address the Union World Conference on Lung Health. So please give a hugely warm welcome to the one and only John Green.
Hi, friends. Hello. Thank you for being here. I know it's been an incredibly difficult year, and now you get a novelist as your keynote speaker, so it's not necessarily going to get better. I just want to begin by noting the ridiculousness of this whole affair, that I'm not a clinician or a TB survivor. I'm not working for a company trying to expand access to TB diagnostic or treatment. I'm not a researcher or even much of a historian. When I read your papers, and I do read them, I have to stop dozens of times every paper to Google your endless acronyms. In truth, I might literally be the person in this room who knows the least about tuberculosis, and yet here I am with a microphone, so we're going to do our best. I do know a lot more about TB than I did in 2019. If you told me in 2019 that I would leave behind my career as a novelist to write a book about tuberculosis, I would have told you, is that still a thing? I thought TB was a disease of 19th century British writers like John Keats and Charlotte Bronte. I didn't know that tuberculosis was the deadliest infection of the last 2 centuries, killing an estimated 1 billion people. I didn't know that my own great-uncle, Stokes Goodrich, died of tuberculosis in a sanatorium in Asheville, North Carolina, one of many American cities that grew as a tuberculosis colony. I didn't know that at the height of the TB crisis in the United States, there were almost as many hospital beds just for people living with TB as there were for all other healthcare conditions combined. And I certainly didn't know that TB continues to be the world's deadliest infection, killing 1.2 million people per year, more last year than died of malaria, typhoid, and war combined. Even though TB has been curable for around 70 years. And tuberculosis, like many other healthcare inequities, follows the paths of injustice that we blaze for it. As Dr. Peter Mugeni said 25 years ago about access to HIV/AIDS drugs, where are the drugs? The drugs are where the disease is not. And where is the disease? The disease is where the drugs are not. And this remains true, not just for TB drugs, but also for diagnostics and preventive therapy. I mean, if my kid gets TB tomorrow, I'll be placed on preventive therapy without question. But when I visited a woman living in a tiny room with 6 children, one of whom had just been diagnosed with TB, there was no preventive care for her. What does this say about us? What does it say about the world we've built and the worlds we might build instead? But of course, y'all know that. You know all of that and much more. Many of you have forgotten more about TB than I'll ever learn. So instead, let me tell you the story of one young man who's been mentioned a couple times here today, Henry Reider. Henry is a close friend of mine. His story forms the backbone of my recent book, Everything is Tuberculosis, and we talk most days. Henry grew up in Sierra Leone in a deeply impoverished community, and the history of Sierra Leone's impoverishment is long and complex, but I think it's worth at least mentioning here. As a center of the transatlantic slave trade, Sierra Leone was profoundly shaped by slavery. Social orders and economies collapsed due to fear and violence. Sierra Leone then had a long history of colonial impoverishment, followed by a devastating civil war, and as a result, many Sierra Leoneans live in profound poverty. Like here in Denmark, around 10.8% of the country's GDP is spent on healthcare. If Sierra Leone spends the same percentage of its GDP on healthcare, the nation has about $94 per person per year to spend on health, which is almost enough to pay for my Lexapro prescription, but not nearly enough to fund a strong healthcare system. And so these are the historical forces that were pressing in on Henry's life from the moment he came into the world in the early 2000s. Although his parents worked hard, they were poor, but his school fees were always paid, and he was a good student with a broad friend network. His friends called him Pastor because he was always praying for them. And then Henry and his mother Aisatu both became sick when Henry was in primary school. They were eventually diagnosed with tuberculosis, but the word eventually is doing a lot of work in that sentence, work that in real life was done by Aisatu and Henry as they traveled from clinic to hospital trying to understand the sickness that had overtaken their lives. Because even after 140 years of knowing what causes TB, we still don't have great tests for kids, or at least great tests that are widely available. And Henry was eventually diagnosed clinically and started on first-line antibiotics. After a couple months of taking treatment, Henry's father decided to take him off of therapy and rely on faith healers to address the illness, which is an easy decision to judge. I myself struggle not to judge it, but at the same time, the healthcare system serving this family had done very little to earn their trust. Understaffed healthcare delivery sites lacked the space, staff, and systems to deliver real care, and as a result, Henry's father just didn't believe the clinics could help. And you can guess what happened next. After feeling okay for a while, Henry became sick again, this time with a devastatingly drug-resistant form of tuberculosis. By the time he was 17, Henry was living full-time at Kluge Government Hospital, the only dedicated TB hospital in Sierra Leone. And that's where I first met him in 2019. He was a small young man, although he was a teenager, I thought he was 9 or 10, who walked me all around the hospital, showing me the kitchen and the wards and the lab. And because he shares a name with my own son, and because he had some of the same mannerisms as my son, I immediately felt a depth of connection to Henry that I should feel toward all humans. He didn't seem particularly ill, especially compared to many of the other people with TB at Kluge, but the doctors told me they were very concerned about him because they could tell that the last available line of antibiotics was coming up short for him. And I need to emphasize the word available, since there were tertiary antibiotics that might have cured Henry. They just weren't available at the time in Sierra Leone. In 2023, I visited Sierra Leone again and nervously asked one of the nurses if she remembered a patient named Henry Reider. "Oh, Henry," she said. "Of course, he's here to visit with you." Henry and I were reunited. He was now a healthy-looking college student studying public resources management. By then, I'd been writing about TB for years, not because I was trying to write a book, but because TB had become a metaphor in my mind for everything wrong and also everything right about public health and healthcare delivery. Henry survived thanks to the extraordinary efforts by his doctor, Dr. Jérôme Tefera, who told me once, "I know he is only one child, but what if he can be the first of many?" Dr. Tefera is here today, as is Henry's other longtime doctor, Dr. Michael Matzi, and I would be grateful to both of them if they could stand and hear our thanks. Thank you. So I know many of you have your own Henrys, and Dr. Tefera's hope that Henry would be the first of many has proven true. Now many people in Sierra Leone with complex drug resistance are able to receive the kind of targeted, personalized TB care that they need. Henry also benefited from great effort by the NGO Partners in Health and by the Sierra Leonean Ministry of Health. Most of all, and I think Dr. Tefera would agree with this, he benefited from a mother, Aisatu, who simply never gave up on him. We have all seen the horror of TB stigma, as chronicled brilliantly in Handa Amgalan's book, Stigma. We have seen that it is common for people to be abandoned by their family and friends when they're diagnosed with TB, or for a TB diagnosis to render them purportedly unmarriable or unlovable. We have seen how the disease is not just a biomedical phenomenon, but a psychosocial one, which is why community organizations are so essential in the treatment and addressing of the TB crisis. As one TB survivor explained to me, fighting the disease is hard, but fighting the stigma is even harder. But Henry had Aisatu, who was unwavering in her support and brought Henry extra food whenever she could, which Henry credits in part to his survival. A reminder, as if we needed another one, that when it comes to TB and so much else, food is medicine. And so thanks to Dr. Michael and Dr. Jérôme and his mother, Henry is here with us today, a successful and hardworking college student. After very generously being invited to this gathering, Henry and his mother obtained passports. Because there is no Danish consulate in Sierra Leone, they had to fly to Ghana, surrender their passports, and wait for what was supposed to be 15 days. They decided to stay in Ghana rather than fly back and forth because it was cheaper. Aisatu was eventually denied a visa. These kinds of stories are common in impoverished communities. As I said earlier, many of my TB heroes are not here, either due to lack of funding or lack of visa. I do not mean to single out our host country. In fact, it's literally impossible for Henry and Isatu to visit my own home country of the United States because of a total travel ban for Sierra Leoneans that has been issued by the Trump administration. And so Isatu isn't here to tell you about how to love and save a kid with tuberculosis, even though hearing from her would be, I would argue, critical, because we learn the most about tuberculosis from the people nearest the experience of tuberculosis, those addressing stigma and providing proper nutrition, and so Isatu has much to tell us. But it is thanks to Isatu, as well as Dr. Michael and Dr. Jerome, that Henry is here with us. And I don't just mean here with us in the sense that he survived, I mean quite literally here with us in Copenhagen because his visa was approved. So, Henry, can you come on stage for a couple of minutes and share some of your own experience? Thank you.
Hello. Good morning, everyone. I really appreciate to be in this place. It's really awesome to be alive again. It was not easy. I remember the wall of Dr. Doom. I can see the wound drying, right? For me, that was a first real sign of restoration. Restoration in the sense that I will be back alive, coming alive again, right? The hope that within the week that the drugs or the remedy was arrived, I was really frustrated. It was my first experience of restoration. But the journey was not simple. It was a mysterious battle, one that really need unique fights. The right drugs is not available. Right, it was really pressure for my mom, Asatu. At the point, I felt like a warrior without determination. I kept praying that I could not fall deeper into the hole because, honestly, I had nothing to hold on. Yes, indeed, my mom played a great role by providing essential foodstuff for me. Although there was a heartbreak, but I keep the fire burning. For over 3 years of my life, I have lived in a surrounding where comfort was not enough and hope was almost impossible to find. I was helpless, wondering like why I was unable to live in a Laka and also in different hospital since 5 years. I watched my best friend, die closer to me. It was really frustrating to see, thinking that I would be next. I watched my best friend die. It's really frustrating. At that moment, I got shocked deeply, yet my mom consoled me. My mom was there. My mom was trying to be that person that can stay during the storm. It's really, really, really hard for me, but I never, ever forget the special person that is a hero towards my success in my health. Someone who remained a source of the light when all hope remained on source, right? And when all hope was lost, there was one person that stand when many warriors are going down, and I think I was the next warrior to go down. It was really sad. I tried to keep on going because today is the day of restoration. A big thanks to Doctor. Yes, a big thanks to Doctor because it is a hero that comes from Ethiopia, around Addis Ababa, if I correct, who got inspired by our loving mom, right, providing solution because she is his only mom. This doctor not only provide solution for a mom, but also provide solution for the world today. As I'm standing talking to you guys, we are saving thousands of people's life in Sierra Leone because of this one man that tried to provide one solution that helped me stay alive again. This person is an individual who was grown up in Ethiopia and also loved by his father that supports him to pursue his dream and achieve the great day of saving people's life. Since that day, it was really inclusive, and that only person is Dr. Durum. Really appreciated. Since my childhood stage, I have never enjoyed my life like I do now. All thanks to him, Dr. Durum. Now I have gained growth and very active at my school journey. And now I am in the university. I'm trying to finish my course next year. Before then, I was unable to record everything I studied on my low level since primary school. When I tried to study, nothing remained in my brain. But through the help, after I got from the hospital back to school, I started recording everything I studied, which gave me a powerful performance in the previous days I'm in the university. In a world where everyone is running away from me, there was an individual who stand by me and ready to go down with me into the hole without finding where to hold. That person is great. She stands with confidence, with resilience. Pain arise, she cry. She sell everything to help me find somewhere to hold. Amazing person is my goal, my comforter, my inseparable bond. Who was also trying to see that I am alive today. She was born on the 13th of May, 1968, and I was able to be in this world because of her. She grew up in an amazing environment, which is Bond District in Sierra Leone, right? Later, she started struggling with her sister because the sister took her from the village to do house chores, lying to their parents that she would take care of her to be in the school, but no avail, right? She started suffering that person, and she dropped out from school, helping his sister to sell different things. But she was really amazing. That big person, I really want you guys to give a hand of applause for my mom, Reider. And finally, it's really amazing to see my mom happy again, to see that I'm restored because of this issue. She cries, she spent everything, but thank God she is finally happy. So big thank you to Partner Health, TB Fighters, and also my father John Green for inspiration and bringing up the decision to save life in the world. Dr. Michael, I recognize you. You are great. The first time I visited the hospital, I was really frustrated, but he provided a motivational word for me and my mom, and we keep the fire burning. Don't forget to be handsome. That is the goal. That is the achievement. Thank you.
Henry Reider, everybody. So as Henry said, Aisatu should be here. And the fact that Aisatu isn't is a real injustice. And I would argue that Aisatu's visas woes actually have something to do with lung health. First, TB and visa injustice are both a reminder that poverty is expensive. I incurred lots of expenses associated with trying to get Aisatu here, so did the conference itself, but that's nothing compared to the cost for Henry and Aisatu. They lost not just money, but the most valuable commodity of all, time. Time for school and work, time for building relationships. They lost years of life to tuberculosis. Henry and Aisatu were separated except for her visits for nearly 3 years due to Henry's TB, as he told you. And they lost time again due to visa injustice. Poverty is expensive. It takes more time and money to navigate systems that are built to exclude the poor. I spoke to a mother recently in the Philippines who spent over $100 to get her son diagnosed with tuberculosis, money she didn't have that only drove her further into poverty. Time and well-being lost to tuberculosis is expensive. Secondly, lung health and visas are connected because visas shape not just who gets to talk at the highest level of about the TB crisis, but also what kind of conversations we end up having. I think this is why, for example, we spend so much time worrying about corruption in poor countries when it comes to aid, but do not spend as much time worrying about corruption in the form of price gouging when it comes to aid. I think this is also why we have so many resources for diseases that commonly affect rich countries and do not have resources for tuberculosis. All of us know, from private enterprise to big donors to researchers to clinicians to, yes, even young adult novelists, all of us know that all human lives have equal and immense value, and it falls to us to build better, more inclusive systems that reflect that truth. Because right now the systems just don't reflect that reality, as Aisatu and so many other absences remind us. So I'm a rank amateur in a sea of experts, but what I do know about is story, and in addition to being a biological process, this disease especially is also a story. Diseases are the story we tell about them and the people living with them. In 19th century Europe, tuberculosis was seen as an ennobling disease, one that made you brilliant and beautiful. As John Keats was sick with TB, his friend Percy Shelley wrote him, "This consumption is a disease particularly fond of people who write such good verses as you have done." Although my friend Henry is also a poet, as you just heard, nobody told him he got TB because of his excellent poetry. Nobody told him consumption, I am aware, is a flattering malady, as Charlotte Bronte put it. Now we imagine tuberculosis much differently, but we are still inevitably, humanly imagining it. And those stories shape who lives and dies of tuberculosis. When we tell ourselves that the story that some human lives matter more than others, we come closer to living in that world. And when we tell ourselves the story that all human lives must be treated and valued equally, we come closer to living in that world. So last week's Global Tuberculosis Report contained heartening news, I suppose, a 3% reduction in death and a 2% reduction in burden year over year, which is higher than we could expect just from increasing standards of living. The burden of DR TB is also decreasing, albeit slowly. And that's all evidence that the work that's being done by the people in this room matters, as is the fact that since I graduated from college, you've helped reduce tuberculosis deaths by around 50%. But what do I tell the young man in the Philippines who's struggling to access treatment, whose mother lays awake at night worrying about him as he coughs near his 5 siblings? That we are making progress, just not for you? There are exciting promises on the horizon, of course. Vaccines, new drugs, very soon better near point of care tests, but so many are still left out. In Henry's country, the goal is to have 90% of people on TPT. Currently, they're at 2.9%. Our efforts when it comes to preventing and treating and especially diagnosing TB in children remain woefully under-resourced. And the overall funding pullback is a crisis for our ability not just to address the global TB problem, but even to analyze and comprehend the size of that problem. So I'm encouraged that we've been making progress, but I'm reminded that none of this progress is guaranteed and all of it is too slow for the people who need it most. I'm a little tired of hearing when discussing funding cuts that every crisis is also an opportunity. That's easy for me to say. My job isn't on the line. My life isn't on the line. Yes, a crisis is an opportunity to reimagine global health, to perhaps build back better and so on, but it is also a crisis. And on every level, it is a man-made crisis. As Paul Farmer liked to say, it is true that resources are limited, but they are less limited than ever before. We have plenty of money as a global community, not just to end tuberculosis, but to end inequitable access to healthcare more generally. It would cost hundreds of billions, but of course we have hundreds of billions. It would involve sacrifice, but what is more worth sacrificing for than the well-being of our fellow humans? Imagine a world of active case finding where people are not so sick that they come into a hospital to be diagnosed with TB, where their risk of post-TB lung disease is minimized. Imagine a world where their family doesn't get sick because they can access the preventive therapy that I would access no problem. Imagine a world where the burden of TB is about the same in every country, because why the hell shouldn't it be? But yes, I know, we are not currently in that world. We are currently in a world of more constrained resources, where the burden of TB could rise owing directly to decisions made by governments, mostly my government, and where so many of you, I know, are mightily struggling to find a path forward that prevents regress, let alone that fuels continued progress. On behalf of my country, I want to say that I am sorry and also that I am ashamed. It seems small-minded, that's because it is small-minded. It seems punitive, that's because it is punitive. It is a mark of shame on the United States, which has long been a leader in global health funding. And yet, this will not be the final chapter in the history of our fight against tuberculosis. 2,000 years ago, the great physician Hippocrates told his students not even to try treating consumption, it would only make them look like bad healers. 200 years ago, we still disagreed as a species over whether TB was contagious or inherited. 20 years ago, we had no widely available molecular tests for TB. I inevitably think of the history of TB as a long story that ends today, because today is the last day that we've lived through together. But today is not the last day. Today is not the end of the story. Today is the middle of the story. And in many ways, it is a heartbreaking, infuriating moment in the story, but it is not the end. We have better tools than ever and more coming. We have commitment from the people in this room and many more people. We have a disease that is preventable and curable, and today is not the end of the story. The end of the story is when TB is eradicated as a public health threat in our world, and I believe I will live to see that end, thanks in large part to your work. Thank you.
Wow, how do you follow that? Thank you to John and Henry for your heartfelt words. And Henry, thank you so much. We're so pleased that you managed to come all the way from Sierra Leone despite all the hurdles. And we're so sorry that your mum couldn't make it. And we're all sending big love, aren't we, to your mum. So thank you so much. And also, we wish you all the best in your university life as a student and your life going forward. We're so pleased that you've got to this stage, but sad, obviously, about your friend as well. But I think, both of you here today, we can always have a novelist here, can't we, every year? I think you've proven a keynote speech for a novelist is a perfect setting. So thank you so much again to John and Henry. And if you want more of John Green, well, he'll be appearing throughout the week here at other sessions, including the Community Connect session on the power of storytelling and how this can influence change. And that's on Wednesday in Meeting Room 19. And John will also be appearing on Thursday's session on New Warriors Take on an Old Enemy. And that'll be here in the auditorium. You can find out details on timings and locations for those two sessions in the conference app. I did tell you to download it, so there's a compelling reason to do so. So thank you again. Well, let's now move on to the next part of the opening session. And over the last 7 years, Professor Guy Marks has been President of the Union, and delighted that he's here today to address the conference. So please give a very warm welcome to Professor Guy Marks.
Thank you very much. Nadine, for that introduction. I feel like a bit of letdown after the last presentation, which was extraordinary, and I'm not going to be able to match it, I'm afraid. But I do want to welcome you on behalf of myself, on behalf of the Union Board and the Union to Copenhagen. I want to welcome those who are here in the room and those who couldn't make it but are with us online to this year's Union World Conference on Lung Health, or as some of us like to call it, the Union Conference, or as us very linguistically lazy Australians like to call it, just the Union. I want to begin by thanking John and Henry, not just for their generosity and graciousness in joining us here and for their very inspirational and very eloquent words today, but for the courage, compassion and commitment that they've demonstrated, both of them, in raising the profile of tuberculosis on the world stage that frankly we could never dream of. Henry, as you saw today, and as you will have read in the book, I hope many of you, personifies much of the tragedy and the injustice that's the consequence of our failure to end TB. But he also personifies the resilience that's required to achieve that goal, and I want to thank him for that. He and John have highlighted these struggles in a most unique and powerful way. At this time last year, I spoke what I think in generally optimistic terms, it seems like forever ago, about the promise of new diagnostic technologies and treatment regimens, about the promise of new approaches to TB elimination, that if widely adopted, could transform the historically dismal trajectory that we have towards TB elimination. That promise has not actually changed, but it is hard for me, even for me, to remain optimistic as we approach the end of 2025. We are facing deeply troubling times and trends. Rising authoritarianism and a retreat from liberal democracy, rising nativism, divisiveness and intolerance, and a retreat from acceptance and globalism. How many countries was it here? 130 or something countries here. We are a global organisation and we are proud to to be at the forefront of globalism, but we're finding a retreat from this. Rising inequality and environmental degradation, and a retreat from commitment to social justice. Loss of respect for and trust in science, the humanities, and evidence. An elevation of celebrity, of influences, and of convenient facts at the expense of authenticity and facing up to inconvenient truths. And a retreat from the values of the Enlightenment that we have taken for granted since the end of witchcraft. All this just 25 years after the adoption of the Millennium Development Goals and 10 years after the Sustainable Development Goals were adopted to widespread acclaim. To me, this seems like an epoch ago. But it's not just a change in the words, it's not just a change in aspirations, it's not just a change in the zeitgeist. It's affecting real people in their real lives, here and now. Many in this room, and many who could not be with us in this room, have lost their jobs. Through no fault of their own, their lifelong commitment to science, to healthcare, and to health policy has been discarded. Research programs and careers have been ended, or at least interrupted, and many have lost their health and their lives due to the cuts in healthcare funding and lack of availability in healthcare. I want to acknowledge the pain of those individuals, their families, and their communities. Not by chance, these political winds of change have been accompanied by a rise in conflict and oppression. In Gaza, in Myanmar, in Sudan, in Ukraine, and in many other places around the world. In most cases, these conflicts, which affect the most vulnerable and defenceless amongst us, are either enabled or even perpetrated by external agents for political or economic gain. Many have deep historical roots that extend to colonial times or even longer. Many in this room and many of the union's members and stakeholders are seriously affected by this turmoil, death and destruction. Our power as individuals, or even as organisations like the union acting alone to effect change, is limited. But collectively, we do have power. We must organise within our communities, within our countries, and within our workforces through unions, where our voices and actions can affect change that matters to us. Collectively, we do have a voice. We must be heard on the matters that concern us in these dark times. We, as the union, have a role to play in the context of our vision and mission. We all, as individuals, have a role to play through civil society. We need to recognise that our leaders, elected and otherwise, have failed us. Our leaders have failed us. They failed to end TB. They failed to create the social, economic and physical environment that we need to survive and to flourish. We cannot wait for elections for our voices to be heard. Civil society and our collective voice must be heard. I want to turn to what your union is doing to sustain and enhance its capacity to achieve its vision, a healthier world for all, free from tuberculosis and lung disease, and its mission to end suffering due to tuberculosis and lung diseases by advancing better prevention and care. We seek to advance this by the generation, dissemination and implementation of knowledge into policy and practice. We aim to ensure that no one is left behind, that people are treated equally, and we have a focus on vulnerable and marginalised populations and communities. I remind you of the 5 core values that guide us: quality, transparency, accountability, respect, and independence. Indeed, we are accountable for adherence to those values. Some in this room may not be so familiar with the union, and I'll just remind you that we're a membership organisation, we're a technical organisation, and we're a scientific organisation. In that sense, quite unique. We've been around for a very long time, at least since 1920. In fact, we were refounded in 1920 after the First World War. Our members are organisations and individuals from all parts of the world. We are made up of government and non-government agencies, charities, donors, funders, professional groups, patient groups, civil society organisations. We bring together clinicians, managers, policymakers, frontline workers, implementers, scientists, patients, survivors, advocates and civil society. As many of you are aware, the union has been through difficult times in recent years. Substantial reforms in governance, management and our business model, along with support from key donors and advisors, have enabled us to overcome an existential crisis that threatened to end the union rather than to end TB. I can report that we are in a much more robust position, although this remains a work in progress. The loss of US government funding this year and other consequent changes are having a serious impact on the union, as they are on many other individuals and organisations. I want to reassure you that the board and the management of the union are doing all we can to sustain and grow the organisation during these difficult times. I am confident in our future, but we cannot take it for granted. We are also attempting to make your union better at engaging with members, better at delivering this conference, better at the journals, the training and education, better at achieving its mission. We are establishing new structures, new modes of communication, new ways of doing things in the modern interconnected world. As I mentioned, we are a global organisation with many members in low and middle income countries. The global nature of the world, and by global I mean round, nature of the world with 24 time zones, the long distances, the threat of global warming, the advent of new modes of communication are both threats and opportunities for us. We're attempting to find the best way through. During this conference, we've programmed several opportunities for you to engage with the board and the senior management, and I hope you'll take up the opportunity to do that. I want to acknowledge our Executive Director, Cassandra Kelly-Cirino, who you heard from earlier, for her outstanding worldwide management team and staff who are leading the delivery of our vision and mission. I want to thank my colleagues on the board and on the leadership of the Union's scientific sections, subsections and regions, as well as the dedicated members of the Union who volunteer their time in our collective effort to end death and suffering due to tuberculosis and lung disease. Finally, I haven't had much to say specifically about TB today, which those of you who know me will know is rather unusual, but I will say a few words. I expect that you will hear much more about TB during this conference, and I want to congratulate WHO on their latest excellent global TB report released last week, and for their ongoing good work in the face of many difficulties. For me, the report highlights how much more we must do. We must raise expectations in countries where sickness and death due to TB are considered normal or a fact of life. In my travels to countries afflicted by a high burden of TB, not that many, mainly in Asia, but I have travelled to several and worked in several, there is a sense of fatalism about this problem. I do not gather a sense of urgency to end TB or any expectation that this is possible. I understand this. There are many reasons for it, including past promises and failures, and the legacy of constantly being told you are too poor to deal effectively with TB and other major health problems. However, sickness and death due to TB are absolutely not normal or a fact of life. Sickness and death due to TB is not acceptable in Europe, North America, Japan, Australia, and many other countries, and it should not be acceptable anywhere. We have all the tools we need to find and cure everyone with TB. We know it can be eliminated and has been virtually eliminated in many countries by population screening linked to good treatment. We need civil society in high-burden countries to demand that their leaders prioritise ending TB now. Thank you very much. Now, slightly more upbeat announcement. It's my honour now to make an announcement about the Union Medal winner. The Union Medal is the Union's highest honour, awarded to those who have made an outstanding contribution to the control of tuberculosis or lung health by their leadership, scientific research and advocacy. We received many nominations this year, and the calibre of the nominations we received from the Union section and regional officers and from board members was incredibly high. This made it very difficult to decide among the nominees, but this year's recipient has played a vital role in the fight against tuberculosis. I'm thrilled to announce that the recipient this year of the 2025 Union Medal is Dr. Jeremiah Chakaya Muhwa. Chakaya has been a leader in tuberculosis control throughout his career, in his home country of Kenya and on the global stage. He has held several senior positions in Kenya, including Chief Research Officer of the Kenya Medical Research Institute, Head of the National TB Control Program and Technical Advisor for the Kenya Association Against TB and Lung Disease. As a founding member of that association, he has steered it to be the leader in TB control, focusing particularly on TB and poverty in the urban slums of Kenya, as well as public-private partnerships in TB control. As many of you know, on the international stage, Chakaya is the immediate past president of the Union. He has served as the chair of the DOTS Expansion Working Group of the Stop TB Partnership, as well as the chair of WHO's Strategic and Technical Advisory Group for TB. These are, of course, a huge tribute to the respect with which he's held within our global TB community. He's respected for his work and knowledge about the region. He has participated in a variety of country and programmatic reviews throughout Africa and, in fact, also in Asia. A passionate teacher, Chakaya has taught the next generation of African public health professionals at schools of medicine, Kenyatta University. Throughout his distinguished career, Chakaya has never forgotten about the people he serves, remaining a practicing clinician and striving to translate scientific knowledge into direct care. I'd also like to say personally that Chakaya is a wonderful person, a wonderful human being, a compassionate and humble man, and a man whom I hugely respect and admire, and I am proud to call a friend. I'd like to welcome Chakaya to the stage to receive his medal and to say a few words, and please join me in giving him a welcome. Where are you? There you are. There's a medal somewhere, but I'm not sure where it is. Oh, here it is.
Congratulations to you.
Thank you so much. I heard about this a few days ago, and I didn't know what to say. I still do not know what to say. It's been a journey of many years, a commitment, a passion, and like we've just heard from the speakers that have spoken today, the job is not done. I want to thank those who have supported me in this journey over many years, those who are before me, those that have been with me, and those that I'm trying to support to come along with me. It's tough work, it's difficult work. The inequities are increasing, the funding landscape is not looking good, but I'm trusting that we will win this war one day. So I want to thank the union for giving me this honor. I want to thank Guy Marks, Cassandra, and others in the management of the union. And with this medal, I am committing to continue supporting the union until we win the war against tuberculosis and other lung diseases. Thank you very much.
Thank you so much. Congratulations to you. Many congratulations again to this year's Union Medal winner, to Jeremiah, for your humility then. Many, many congratulations for your outstanding contribution to lung health. Just to let you know, the welcome gathering tonight is 6:30 to 8 o'clock. Everyone is invited to that. And that's going to be a lovely occasion, which everyone's invited to. It's going to take place in the exhibition area, right across the exhibition area. So mark that in your diaries, 6:30 to 8:30. Well, I want to say, finally, that Community Connect is a space where affected communities and civil society representatives share lived experiences and develop solutions to fight TB and lung diseases. Their voice matters to share perspectives, to inform policy and advocate for change. Go for it!
When do we want it?
Now!
When do we want it?
Now!
Who are we?
Community!
Who are we?
No more!
Yeah.
No more deaths from TB.
Who are we?
Community.
Who are we? When do we want it? When do we want it? When do we want it?
Hello, everyone. My name is Olya Klymenko. I'm TB survivor. I represent TB Community Global Organization, and of course, I represent all of us on the stage. I'm from Ukraine, and it's an honor to me represent a statement from community. Solidarity with my colleague Lucas from Brazil, who cannot join to us. Today, with TB survivors, person affected by TB and civil society, representatives speak for the millions whose lives are impacted. People are dying, losing income, suffering from TB, and unable to access treatment due to the present global health changes. We raise our voices on their behalf. And please, 30-second silence to honor the many lives lost and impacted by TB. These are unprecedented times, and as a united community, we are here to call for you urgent attention and action. We stand here representing every region, Asia, Africa, Latin America, Eastern Europe, and for the empty spaces that represent those affected by funding cuts, conflict, and crisis. When communities are silenced, TB wins. The global financial crisis is hitting hardest, whereas the burden is highest. Lost lives, community health workers fired, programs defunded, and social support system collapsing while TB thrives. It is always the most vulnerable who pay a heavy price. More than half of the children with TB remain undiagnosed and are missing out on life-saving treatment. We cannot mark World Children's Day this week, the Day of the Child, without demanding dignity and protection for every child affected by TB. Stigma and discrimination continues to thrive in our communities, and is a huge burden to access and care and support. TB continues to be a disease of inequities, and people with TB and their families deserve the right to survive TB without falling into poverty, hunger, or despair. TB is preventable and curable. Yet, as the recently launched 2025 Global TB Report shows, remains the leading infection disease killer in the world, killing more than 1 million people each year and making close to 11 million ill. TB persists because of the inaction, lack of political will, and limited funding for TB. Invest in communities and save lives. Across Africa, TB and HIV community systems have lost funding, yet community health workers continue to serve, many as volunteers. This is exhaustion and injustice, not sustainable, nor acceptable. Southeast Asia bears the highest burden of TB and DRTB, yet funding for communities working on the ground has stopped. We see promising advances in TB diagnosis and TB vaccines, but tools alone cannot save lives. Only systems supported by diverse stakeholders, including those most affected, can. The barriers to access these tools must be removed. Without fully funding community structures to generate demand, sensitize populations, advocate, and support delivery, these tools will never reach those most in need. And we must do more than diagnose and treat. We must support. Community engagement, awareness raising, and stigma reduction are the only way to find the millions who are missing and care of them. Social support, $1 million a day of testing, transport vouchers, even small cash transfers save lives. The WHO nutrition and TB guidelines are out. We want to see them implemented in the countries. People cannot recover from TB while hungry, isolated, or unsupported. An urgent shift is needed, from biomedical alone to holistic people-centered, from donor charity to investing in communities as partners and co-creators. A social disease requires a social approach. We as communities affected by TB and civil society are dismayed and disheartened by the global regression in values of solidarity that have begun to unfold this year. None of this is happening in isolation. These filters are political choices. We call on all partners in the fight to end TB to stick the science to evidence and roll out a comprehensive approach to end TB. Partners in the Global South need to step and lead the TB response. To traditional donors who have backed away with abrupt funding cuts, we need you to come back as an ally. Global challenges require global solutions to make this world safer and healthier. Ending TB in our lifetimes, it is a serious risk for us and future generations. But together we can. It's now or never. If you are with us, we ask you please to stand up now and show us you care about us.
What do we want?
End TB.
What do we want?
NTB! Yes, we can! 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 For children! For children. Thank you, appreciate. Yes, we must end TB. And without communities, you cannot do this.
Thank you. Thank you so much to all our fantastic community voices that impassioned plea to end TB. And I now would like to declare this conference officially open. But let's leave the last round of applause for our fantastic community voices. Thank you. Thank you.